Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today's webinar topic is PPE, best practices in nursing home settings. Everyone has entered the meeting on mute, but we will have a discussion following the presentation. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We invite you to join us every Wednesday for more of our weekly webinars. Next week's webinar will be a rebroadcast of our recent webinar called 2023 in Review, where we've been and where we're going. And that webinar will be the same time and place next Wednesday at 2 p.m. And now I'd like to introduce our speaker today, Jennifer Brown. Jennifer is a quality improvement specialist and infection preventionist at Quality Insights. She is a registered nurse with over 10 years of experience in a variety of healthcare settings, most recently as Director of Staff Development and Infection Prevention in long-term care. She has also led several quality improvement and infection control initiatives in acute and ambulatory settings. Jennifer, welcome, and thank you for joining us again today.
Thanks, Kathy. Glad to be here today. Welcome, everyone. We are going to be talking about PPE best practices in nursing home settings today. During this time of the year, we're in the midst of influenza season. There's a lot of respiratory illnesses that are circulating around. So I just wanted to give an overview of best practices and provide just a quick refresher on PPE. So, but I had this thing. Okay, here we go. So just a quick introduction about PPE in nursing homes. We utilize PPE to help break the chain of infection. It's a really important part of providing protection to residents and staff to prevent the spread of outbreaks and illnesses within facilities. So PPE is really important because it protects vulnerable populations who may be more susceptible to infections, especially elderly residents. It guards healthcare workers from exposure to infectious agents, including caregiving activities, and provides a crucial line of defense in the case of unexpected outbreaks or infectious disease emergencies. Minimizes the risk of cross-contamination between residents, staff, and different areas within the facility. So we'll talk a little bit about the current state of PPE in nursing homes. I know just a couple of years ago, we faced several challenges in procuring PPE. Now that we are out of the public health emergency and things are improved with COVID-19, the PPE is readily available. We're able to get masks, N95s, gowns, gloves, just really easily. And it's important to, acknowledge the PPE shortages that are mostly resolved at this time. But there are still some challenges in getting specific types of PPE, especially with N95, making sure that we're getting the same type, picking the best ones for our facilities so that we can properly mask fit. That's something that some facilities are still, faced with right now. And also staff training and compliance with everyone being very short-staffed. It's hard to utilize that training schedule, but I always recommend when we're doing our staff training, even micro learns, short in services can really reinforce some of the best practices that we're going to go through today. Another challenges that are being faced is mass fatigue. At this point of, the COVID-19 pandemic, staff does complain a lot about keeping the masks on for long periods of time. However, it's important. It's a really important part of our PPE program So I would recommend, coming up with strategies to mitigate that challenge. One thing that I've seen people do is provide a break area where, the person can be by themselves and take a break from wearing the mask for a while. Other things that can do is make sure that they're fit properly so it doesn't provide unnecessary strain on the ears or on the face when they're being worn for a long period of time. Another challenge in staff training is making sure to reinforce the proper donning and doffing procedures. Sometimes, when we're going about our workflow, we're trying to go quick in and quick out, but that donning and doffing procedure is really important to reinforce with them, because that is the time when there's the biggest risk of cross-contamination. And we'll go a little bit more into that in a little bit. We'll talk a little bit about the impact on resident and staff safety. Having strong PPE protocols gives a big impact in the overall infection prevention program, protecting the vulnerable population and reducing the risk of that cross-contamination. It also helps with outbreak prevention and staff infection prevention, which can be a real challenge, especially if a lot of staff gets ill, contributing more to staffing shortages. So we'll talk a little bit about the types of PPE in nursing homes. We have lots of different types of PPE available. Different categories that we have are masks, gowns, gloves, and face shields. We'll talk a little bit about standard precautions. These are general infection prevention practices that apply to all resident care, regardless of a suspected or confirmed infection. This includes the use of hand hygiene, the use of PPE, sharp safety, and environmental infection control. These are sort of things that we do just to protect ourselves and our residents, because you just never know when someone has an infection that hasn't quite come into full force yet, and you want to take care not to contract anything from someone if we can help it. So all transmission precautions that we'll talk about are in addition to standard precautions. These precautions should be done across the board, especially hand hygiene, which is our best first defense against breaking those chains of infections. So we'll talk a little bit about contact precautions. PPE required for contact precautions are, of course, standard precautions, but also gown and gloves. Healthcare personnel caring for residents on contact precautions wear gown and gloves for all interactions that might involve direct contact with the resident or potentially contaminated areas of the resident's environment. For droplet precautions, we're going to use standard precautions plus a mask. Airborne precautions, we're going to utilize the standard precautions plus N95 respirator, or PAPR if the person is not able to tolerate an N95, or if they have a full beard or some other contraindication for utilizing an N95. When having residents on airborne precautions, the preferred placement is in an airborne infection isolation room. Then we have COVID-19 precautions. COVID-19 precautions, we want to utilize our standard precautions, but also N95 respirator, gloves, gowns, and face shields when we're providing direct care to our residents. And also enhanced barrier precautions, which is a type of infection control intervention that aims to reduce the transmission of multi-drug resistant organisms in nursing homes. So these precautions involve wearing a gown, gloves, while providing high contact resident care activities. These activities include dressing, bathing, showering, transferring the resident, changing their linens, providing hygiene, and any device care or wound care. So when we're doing our PPE, as I mentioned before, donning and doffing is really important to remember the procedure for this, because this is the area where you're most likely to get cross-contamination. The first thing that needs to go on is your gown. Make sure that it's fully covering the torso, not just sort of draped over the arms and just hanging down. Make sure that it's tied at the neck and in the back at the waist. We also want to use a mask next, then goggles or their face shield, and then gloves. When taking your PPE off or doffing, I'm going to take the gloves off first. Make sure that when doing that, you're careful not to contaminate your skin, because whatever infectious agent was on the outside will now, have the potential to get on your body. So make sure to grasp the outside of the glove with the opposite hand and peel off. Make sure not to snap, because then that infectious agent can be spread, without the around the environment of care, on the resident or on yourself. So make sure to just peel it off, and then hold the glove in the unaffected hand, and then use the next hand to take off the initial glove. Then after gloves are taken off, take off the goggles, then the gown, and then your mask or respirator. There have been some recent updates and guidelines surrounding the PPE. We've talked about that in the past webinars, but there have been some changes in mask usage. It's not just a universal mask protocol. Depends heavily on your county positivity rates, your county hospitalization rates. The best way to stay informed about changes and guidance is going to the CDC website, your state and local guidance, and then also CMS, which provides guidance on which PPE should be used within the nursing home. So as I mentioned, it's really important to train your staff on proper PPE usage, make sure they're aware of strategies to, utilize the proper donning and doffing, what PPE they should be using for which situation. There are some strategies that educators can use to get that information out to their staff, such as microlearn opportunities and hands-on demonstration. A lot of opportunities are available to utilize your glow germ. Sometimes people use chocolate pudding or shaving cream to provide hands-on real-life demonstrations on how to properly don and doff your PPE. And also CDC's Project First Line is a great resource for education on infection control issues. And they have short snippets of video that you can utilize during your education, PowerPoints, and print resources that you can print out in order to get that information out to your staff. These are just some resources that I find helpful when educating staff and residents on PPE. Quality insights, of course. We have tons of resources available on our website on these issues. Project First Line, as I mentioned, CDC, they have a transmission-based precaution website where you can find great resources there, and also OSHA, which has information about utilizing the respiratory protection plan and making sure your plan is up to date. Does anyone have any questions?
All right, thank you, Jennifer. There's no questions in the Q&A so far. So we'll start that here in a moment. I'll run over some closing show notes. If you have a question or comment, please submit them using either the chat or the Q&A tool in your Zoom menu. And you could also raise your hand if you would like to request to be unmuted to ask your question out loud. I'd again like to invite everyone to next week's webinar, which will be a rebroadcast of our recent webinar called 2023 in Review, where we've been and where we're going. And that webinar will be next Wednesday at 2 p.m. And we invite you to bring your questions to our virtual live chats every Tuesday and Thursday at noon. Deborah Wright will be there to answer questions on topics such as quality improvement initiatives, infection control, or MDS coding. You can find the links to our live chats and our webinars in the newsletter we send out each Friday called the Last Minute Lowdown. And if you'd like to receive that newsletter but don't think you're on the mailing list, you can email me at ccaudell@qualityinsights.org and I will get you on that list. And I'll drop my email in the chat shortly. And I see that there's a hand raised. So Michelle, you should now be able to unmute yourself to ask your question.
Yes, I was wondering, she was talking about the availability of masks. So when we do our fit testing, if we then have to get a different brand of mask or a different style of mask, do we then have to refit test everyone?
Yes, unfortunately, the fit testing is specific to the mask. While you're doing your fit testing, the staff member should be, tested on your available mask, which one fits them properly, and then document what mask they should be using, what respirator they should be using. If you have a change in your availability, you have to make sure that the mask that you're replacing your current stock with actually fits the staff member.
Thank you.
Thanks for your question, Michelle. And that's the only question we've received. We did have a nice note in the Q&A that says, thank you, no question, but thank you for this reminder. I found this very helpful. So thank you for that. We appreciate it.
You're welcome.
And I think that's it. So I will go ahead and wrap us up for today. Of course, actually, Jennifer, is there a contact page on that next slide if you want to go ahead
Yes.
scroll to that one? I did put your information in the chat as well. But yes, there's Jennifer's contact information for anyone who needs it.
Yes, if anyone has any questions specifically about their facility or need help with their, infection prevention plan, PPE policy, you can reach out to me anytime.
All right, thank you, Jennifer. I think I can go ahead and wrap us up then, since that is it for questions. Before we sign off, we'd like to ask everyone here to please answer a short evaluation of today's webinar. It is anonymous and it will show as a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. Jennifer, thank you for joining us again this week and for this great presentation. And we thank all of you for joining us and hope to see you back here again next week or sometime soon. Yes, and happy holidays to everybody.
Thank you, everyone. Happy holidays.
Bye.